Hi, welcome to Tiny Tot. You're watching the highlight from one of our in depth discussions on neonatal medicine. If you'd like to watch the full discussion, the link is in the description below.
Yes.
Another
Yes.
question, which also might be controversial, is we often talk about the family integrated care, and some people might say it's a fashionable answer, parents at the bedside doing caregiving, but doesn't it quietly load the burden onto families, and doesn't it privilege the parents who can afford to be there all day? What I mean by that is, what if a mother is working two jobs or one job, or a family is living 3 hours away? Are we building two-tier NICU where the presence of parents equal better outcome? So only some parents can pay with their presence?
Yeah, I think that's an excellent question. I think you're really targeting the idea of how do we incorporate equity and
Yeah.
inclusion and diversity in defining these, popular terminologies, as you mentioned. So, for me, I think I have a simple answer, and that's what I tell parents all the time as well, is that it comes down to quality, not quantity.
Mm.
I think, I've seen, many different stories. I've been privileged to see them and be a witness to them. And as you described, Dr. Shiva, very accurately, many parents do have multiple responsibilities.
Yeah.
That's actually the average parent right now. They are both working, they have other children, they may not have the help, or they may live a long distance from the hospital as well. So you are absolutely right. So we have to take into consideration these factors and not undermine these parents because they cannot be there for these reasons. But what we can do is also show the parents and demonstrate the power of even being there fully emotionally, even for a few minutes.
Yeah.
I tell
Yeah.
parents all the time, by the way, I talk to parents who are there at home. They are full-time homemakers, which I think is a full-time job as well.
It is.
And absolutely. But there are sometimes they reach a point of burnout where they are there physically, but they tell me I'm not there emotionally. So
Mm.
for these parents, there is that luxury of time, but they are not there
Yeah.
fully to be able to connect with their children. So, when in the hospital environment, I tell parents, even we also tell parents to be mindful that if they're walking into that room and they are in a complete state of dysregulation, they are anxious, they are just overwhelmed with emotion, we really encourage them to take a break and pause
Mm.
before going
Mm.
in and reuniting with their baby. Because to us, what's more important, instead of reuniting in that state, which can impact and be
Yeah.
paralleled and mirrored in the baby, take
Mm.
care of yourself first.
Yeah.
Take care of your emotions, take a pause, take a break, and then re-enter. Even if it's for a few minutes, that those few minutes can be more precious and more, impactful and meaningful than hours while you're
Yeah.
dysregulated and upset and in distress.